my name's Jessica, and I'm going to be your nurse practitioner today, and I'm going to complete a full head-to-toe assessment. I'm going to start with your hands. Put your hands out for me. I'm going to inspect your hands. Good. I'm going to check capillary refill. Cap refill is less than 10 seconds. Next, I'm going to inspect your head. Okay, next I'm going to palpate your head. Feeling for any deformity, lumps, any infestations. Okay. Now I'm going to inspect the face, looking for symmetry. I'm going to have you puff out your cheeks like this.
Okay.
Okay. Cranial nerve number 7, the facial nerve is intact. Next, I am going to, I'm going to palpate the temporalis and the masseter muscles. Clench your jaw for me. Okay, and again. Okay, cranial nerve number 5, the trigeminal motor aspect is intact. Next, I'm going to palpate your frontal and maxillary sinuses. Any pain?
No.
Good. Open up your mouth. Close it. Any pain?
No.
Okay, the TMJ is intact. No popping or crepitus noted. Now I'm going to inspect the external eye. The eyebrows, the eyelashes, the eyelid are all intact. I'm going to lift up on your upper lids.
Okay.
And have you look down. Good. I'm going to pull down and have you look up. Good. Okay. Next, I am going to have you look back at the wall and focus. Okay. And now look at my finger. Okay. Next, I am going to have you cover your eye. Okay. Tell me when you can see my fingers.
Yeah. Yeah.
Okay. Other eye. Make sure you look straight forward.
Okay. Yes. Yes.
Okay. Cranial nerve number, optic nerve number 2 is intact. Next, I'm going to have you look at my finger in the middle. I'm going to move it in 6 different directions. Don't move your head, just move your eyes and follow my finger. Okay, cranial nerves 3, 4, and 6, the ocular motor, the trochlear, and the abducens nerve are all intact. Okay, next I'm going to perform my eye exam. I am going to have you look straight forward while I perform this. Okay, I'm going to go in at a 45-degree angle to ensure that I do it properly. Red brief light is present. I'm going to move on to the ocular fundus. Okay. There's no AV nicking noted. The background is a creamy pinkish, yellowish, orangish, more of a yellow-orange. The macula is dark and approximately 2 optic discs away. Now we do the same on the other side. Okay, next I am going to inspect the ears for symmetry. There is symmetry noted. I'm going to palpate the tragus. I would do the same thing on this side over here. Any pain?
No.
Good. I'm going to palpate the auricle. Any pain?
No.
Good. Next, I am going to perform my ear exam. Alright, the auditory canal is pink. The tympanic membrane is pearly gray and intact, no bulging noted. I can view the malleus, and the cone of light is at 7 o'clock. Okay. I'm going to switch to the other side. Same thing. The tympanic membrane is intact, pearly gray, no bulging noted. The auditory canal is pink. I can visualize the malleus, and the cone of light is at 5 o'clock. Next, I am going to inspect the nose. Okay, look up for me. Okay. Nasal mucosa is pink and moist, no deviated septum noted, and turbinates are patent. I'm going to have you push one side of your nose.
Okay.
And blow. Other side. Nasal's patent. Okay. And I'm going to jump back. I think I forgot to test the pupillary reflex before. Pupils are equal and reactive. Okay. Next, I'm going to move to the mouth. Have you open your mouth for me? I'm just going to take a quick look inside. Okay. Hard and soft palate are intact. Have you stick your tongue out and say, ah, ah. Okay, cranial nerve number 9, the glossopharyngeal is intact. Next, if I was going to gag my patient, that would be cranial nerve number 10, the vagus nerve. And last but not least, stick your tongue out for me. Move from side to side. Okay, cranial nerve number 12, the hypoglossal is intact. Last cranial nerve that I'm going to check right now is, go ahead and shrug your shoulders. Okay, good. Cranial nerve number 11, the spinal process is intact. Okay, next I am going to move down to the neck. We're going to perform some range of motion. Move from side to side. Okay. Ear to elbow, up and down. Good. Now I'm going to have you turn to this side against resistance. Good. Other side. Good. Up. Good. And down. Good. Next, I am going to palpate the carotid arteries. Carotid arteries are 2+, within normal limits. Next, I'm going to auscultate the carotid arteries. No bruits noted. Okay, now I am going to palpate the, I would have palpated before I listened to the arteries. Actually, no, I wouldn't have. Okay, I'm going to palpate the occipital lymph nodes. Okay, the postauricular lymph nodes, the preauricular lymph nodes, the tonsillar lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the postcervical lymph nodes, the inferior cervical lymph nodes, and I'm going to have you lean your head to the side, and the deep chain cervical lymph nodes. Lastly, I'm going to palpate the supraclavicular lymph nodes. Okay. Next, I am going to palpate the thyroid. I'm going to stand from behind. First, I'm going to note that the trachea is midline, no deviation noted. I'm going to have you swallow. Good. One more time. No nodules noted on the thyroid. Okay. Now I'm going to move to the posterior chest. I'm just going to have you hang your feet right there. Good. Okay. First, I'm going to inspect the posterior chest for any abnormalities of any kind. Next, I am going to palpate any pain or tenderness.
No.
Good. I am going to lean your head forward a little. Palpate down the spine for any pain or tenderness. Any pain or tenderness?
No.
Good. Pain or tenderness?
No.
Good. I am going to have you take a deep breath in and out. Again. Good. Chest expansion is symmetrical. Now I'm going to check for tactile firmitus. I need you to say 99. Say the words 99.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Good. Okay. Any pain?
No.
Any pain?
No.
No CVA tenderness noted. Next, I am going to percuss. Make sure I percuss in 8 different spots. Normally, I would make sure that I'm skin to skin, but due to the patient not being comfortable, I'm going over the top of her shirt. And that's for the purposes of this video. Okay, now that I have percussed, I am going to auscultate, which I would normally auscultate skin to skin. I will try that as much as I can. Deep breath. Again. Deep breath. Again. 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 I'm going to lift up the back of your shirt a little bit. Deep breath. One more time. Good. Next thing I'm going to do is check for egophony. I'm going to put my stethoscope on you. Say the word E. E. Again.
E.
Again.
E.
Again.
E.
Again.
E.
Again.
E.
Again.
E.
One more time.
E.
There's no E to A changes noted. The last thing I'm going to do is I want you to say the word 99.
99. 99. 99. 99. 99. 99. 99. 99.
99 is heard muffled in all fields. So after this, I'm going to move back to the posterior chest. You can go ahead and turn back around with your legs facing this way. Once again, I'm going to inspect the anterior chest. I'm going to feel for any crepitus of any kind. I don't see any or feel any. I'm going to percuss again. And I want to make sure that I percuss in at least 8 fields. Okay? Now that I've percussed, I'm going to listen to the long fields. Deep breath. Again. 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 I'm going to put your arm down to the side. Again. And one more time. Good. The next thing I'm going to do is listen to the apical heart rate. Normally I would listen for a full minute, but for this video, I'm going to say that the heart rate is 87 in regular. Okay. Next, I'm going to have you lay down flat. I'll put this under your head. Oops. Scoot back a little bit more. Okay. I'm going to move to this side over here for my comfort. Okay. I'm going to inspect the precordium for any heaves or thrills. I do not see any. I'm going to palpate the precordium. Okay. After this, I am going to auscultate the different valves with my bell and my diaphragm. First, I'm going to do the aortic valve. And that is in the second intercostal space, the right sternal border. Next is the pulmonic valve, the second intercostal space at the left sternal border. Next is the Erb's point at the third intercostal space, left sternal border. I'm going to come up from the bottom of your shirt, okay? Next is the tricuspid valve, and that is the fourth intercostal space at the left sternal border. And the last one is the mitral valve at the fifth intercostal space, mid-clavicular line. Okay. Next, I am going to move down to the abdomen. I'm going to assess for symmetry, contour. Abdomen appears symmetric. Is it okay if I pull your, okay? I'm going to pull her shirt up, but still give her privacy. The first thing I'm going to do is inspect, as we said before. I'm going to auscultate vowel sounds. Okay, vowel sounds are present. Next, I'm going to percuss the abdomen. Okay. Now I am going to percuss the liver span. I'm going to start at the fifth intercostal space, mid-clavicular line. Okay. Then I'm going to start from the bottom. Liver span is about 8 centimeters at the mid-clavicular line. Next, I'm going to percuss the spleen. Sometimes it's not, sometimes you're not able to percuss the spleen, and that is not uncommon. And I'm not able to percuss the spleen. Okay? I'm actually going to jump back because I forgot that when I was auscultating, I would have done this before percussing. I forgot to listen to aorta, the renal arteries, should be up and out, and the iliac arteries. Sorry that I had to rewind there. Now, after I've percussed, I've auscultated, I've percussed, next I'm going to lightly palpate. Any pain or tenderness?
No.
Good. Next I'm going to deeply palpate. Any pain or tenderness?
No.
Good. Now I'm going to palpate for the liver. Take a big deep breath in. Okay, let out. Again for me. Okay. The border of the liver is smooth. I'm going to attempt to palpate the spleen, which once again, it's not usually palpable. It's covered by the rib cage. Non-palpable at this time. I'm going to palpate the kidneys. Kidneys are non-palpable. On the other side, palpate the kidney. They're non-palpable. Okay. While you're laying down, I'm going to go ahead and test some of your range of motion. Lift this leg straight up and down. This one and down. Good. Now I'm going to have you lift this leg up, but pull your knee to your abdomen. There you go. Same thing with the other leg. Good. I'm going to have you go like this with your ankles. Good. And now your toes. Good. Okay. While you're down here, I'm going to inspect the lower extremities. I'm going to make sure you don't have any edema, tibial edema, and there's none noted. I'm going to palpate your posterior tibial pulse. Your dorsalis pedis. And I'm going to lift your leg up. I'm going to palpate the popliteal pulse. Okay. Go ahead and have you sit up for me. Good. Scoot to the edge. Okay, your upper extremities. Stick your arms out for me. I'm going to palpate your radial arteries. They're intact. Your brachial arteries. Good. I'm going to have you lift your arm up. I'm going to palpate your lymph nodes and your axilla. Other side. Okay. I'm going to have you right like that, like the scarecrow. I am going to test the tricep reflex. Okay. Now I'm going to test the bicep. Relax for me. Okay. I'm going to test the brachio radialis reflex. Okay. I'm going to test the patellar reflex. Good. Other leg. Good. And your Achilles reflex. Reflex, not reflex. Good. Okay. Next, I'm going to take this cotton ball. Tell me if you can feel this.
Yeah.
Ocular branches intact?
Yeah.
Okay. Next, I am going to have you close your eyes, and I'm going to go down your arms. Tell me if you feel a dull or a sharp.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
I'm going to do your legs now.
Sharp.
your feet.
dull, sharp, dull, sharp, sharp, dull.
Good. Okay. Give me 1 second to gather my thoughts. All right, next, I am going to have you, we're going to stand up. Okay. I am going to have you turn that way, and I'm just going to have you walk heel to toe. All right, good. And turn around, look at me. I'm going to have you stand, close your eyes, and stand with your arms out. Okay. Good. Romberg sign is negative. I'm going to have you sit in this chair real fast. There's a few things that I forgot. See right here. I'm going to have you do your rapid hand movements like this. All right. Your cerebellum is intact. And the one last thing, I would have done this when I was checking the reflexes. All right, and Babinski is negative. And that concludes our physical assessment.